My name is Grace Leon-Lozano, and I'm a research assistant with the UNC at Chapel Hill, and I'm working on the age-based genomic screening project. Today, I'll be discussing our efforts in creating culturally and linguistically tailored education materials for our project. The bottom line is, if we want to enhance health equity, we need to answer the call for more diverse and inclusive medical research. Despite making up 18% of the US population, Latinos are heavily underrepresented in clinical research. Known barriers to their participation include language barriers, lack of or low health literacy, lack of mistrust in the healthcare system, and lack of awareness of the research that's being taken. The Age-Based Genomic Screening Project is a new research study that's part of the broader efforts to empower providers and parents with genetic information to improve a child's health at different developmental time points. The project has 4 basic aims: to identify optimal timing and conditions for targeted panels, to work with clinicians and providers on integrating it into well-child visits. We also want to understand parents and communities' thoughts on this type of screening, and we also are going to conduct a feasibility pilot in 6 different pediatric clinics across North Carolina. I focus on aim 3, really trying to understand and address the potential barriers and promote informed health decisions when doing this type of screening. So we are developing educational materials to increase genetic literacy amongst parents and communities. Using rigorous dissemination implementation science frameworks like this one, we ensure that our materials are tailored to the specific needs of our target audience, including the Latino community. This approach not only maximizes the impact of our work, but also provides a roadmap for future researchers and practitioners. So the term Latino is often used to refer to a single homogeneous group in America, but this couldn't be further from the truth. Latinos come from different countries across Latin America and the Caribbean. Latinos come from different countries across the Caribbean and Latin America, each with its own unique cultural nuances. Overlooking this diversity can have implications in healthcare. So let's consider the word t-shirt, right? While it's a simple term, the way it's referred to varies across Spanish-speaking countries in America. This highlights the importance of understanding cultural nuances and linguistic diversity even within a single language. Therefore, to successfully communicate with the Latino community, we must go beyond simple translations. Relying solely on machine translations can lead to misinterpretations and misunderstandings. Luckily, our Spanish translation team brings together bilingual professionals from different countries all over that speak Spanish, and they provide input in what we do. Our translation process involves multiple steps, and in turn starts with a bilingual member creating an initial translation, which is then reviewed by other team members and a genetic professional before final approval. With this process, we've adapted examples to be culturally relevant throughout our educational materials. For instance, we replaced the common hitchhiker thumb genetic trait example in our materials and instead opted to use a more simpler, more familiar genetic trait such as eye color when we developed our Spanish materials. We've also included the metric units and common Spanish phrases that are familiar for our Spanish-speaking audience. In this next example, from one of our learning modules, we demonstrate the impact of a single letter change in DNA. So we use a phrase and show how a single letter can change the meaning of a word and a sentence. So we adapted the phrase, "the gray cat ran down the hall," since a direct translation would not capture the same nuance in Spanish. So instead, we had to consider the linguistical and structure of the sentence in Spanish and changed it to something that will give the equivalent demonstration in our Spanish materials. So by changing the sentence structure and the word choice, we were able to create a Spanish equivalent to effectively demonstrate the impact of a single letter change like we did in our English version. We are currently conducting a pilot study to examine the impact of these educational materials. It is exploring the content and delivery method of our materials on research participation, and we are currently doing surveys and interviews in Spanish and English. And we hope to publish the results of this study soon. In conclusion, developing culturally and linguistically tailored materials is hard. It is also complex and time consuming. While we have a dedicated bilingual translation team, limited bilingual research personnel, and limited providers can pose a challenge for this as well. So to address this, we prioritize a rigorous translation process that involves multiple steps of review and refinement. By prioritizing human translations and collaborating with community partners, we can ensure that our materials are not only accessible to Latino community, but also contribute to the broader health equity efforts. And I would like to thank and acknowledge the funding for this project and my work. I would also like to thank my mentor and PI, Dr. Laura Milko and Dr. Jonathan Berg. I'd also like to give a big thank you to the Spanish translation team, our ABGS Community Engagement and Education Committee, and the Community Research Board that makes this work possible, and my mom and family members that inspire this type of work.
Hey there, I'm Alex with MUSC. When you showed off your team and how diverse it was and all the languages and backgrounds that were there in regards to Spanish, it was really great to see. When you're doing research that you're doing, it all just depends on who you're serving, I would imagine. And I imagine this is the North Carolina area. Okay. And then I don't know what groups are most specific to there, but you guys, I see you have a community research board, but do you have a specific community advisory board that you guys are reporting to, made up of community members specifically in the region you're serving, who are able to give you more specific information on what might work best?
So we do have a community research board that we work with, and so they're made up of parents and caregivers in the North Carolina area. In Lennon, here at the top of our Spanish translation team, he is also part of that community research board. He is the only Spanish-speaking member that we have currently. We do currently try to actively recruit and get more Spanish-speaking bilingual members, but it can be kind of hard sometimes.
Yeah.
But luckily, we do have Lennon, who does give a voice and representation for the community that he works and serves in.
Okay, good luck. One's better than none.
Thank you.
Hello. I also really enjoyed this slide. It was really beautiful to see all of the flags. And thank you so much for sharing your work. And I just had a question. So I imagine that working in North Carolina is also similar to Georgia in the sense that it can be difficult to tap into the Latino community. What strategies would you encourage researchers to utilize to build that trust and that presence that is not threatening and is there to support and understand the community?
That's a really great question, and I think it's a big part of what we do. So having somebody, obviously, that identifies with the Latino identity, I think is super important. Having somebody there that speaks Spanish is also super important. I think not doing that is kind of doing an injustice to the community, because it's one thing to have materials in Spanish and just say, hey, we have it in Spanish, but giving it to them and expecting them to engage with it just because it's in Spanish is not it should lower the expectation of that. Having someone there to speak to them on that level like them, and having someone with maybe the same lived experiences on the team does make a difference. And I do want to preface, I'm from Miami, Florida, so I come from an area that is heavily Hispanic and Latino populated. So working in North Carolina has also been kind of a little bit of a culture shock for me, coming from an area where everybody speaks Spanish and is from a Spanish-speaking community to somewhere where it's kind of like sparse in between and almost feels like it's in hiding. So I think bringing that lens also gives me a different perspective on this project. Thank you.